Welcome back. Well, we have Dr. Teymoorian here today from Harvard Eye Associates. Always good to see you.
Great, thanks for having me. Always having a fun time being here.
Yeah, Happy New Year to you.
You too.
You specialize in glaucoma and cataract surgery. Today, we're going to focus on glaucoma because it's Glaucoma Awareness Month.
Yeah, most people don't know that January is Glaucoma Awareness Month, and the most important message I can relay today is the importance of getting a routine eye exam. Because for glaucoma, unlike the other diseases where people naturally go in to see the doctor when they're not feeling well, if you go in when you're not seeing well and it's glaucoma, it's already advanced glaucoma. So the time to take care of it is early, which means routine exams before it occurs.
Okay, we have a slide on the screen, and our first topic here is what is glaucoma? Exactly what is happening within your eye?
That's a great question. If you really want to look at it scientifically, it's an optic neuropathy with visual field loss. Well, what does that really mean?
Okay.
The way I describe it to my patients is, imagine if you can look on the inside of the eye. At the back part of the eye is the very sensitive optic nerve, the cable line that takes the information from the eye to the brain. I describe it as looking like a donut. And if you look at that donut, it has a little donut hole. For people who have glaucoma for one reason or the other, and there's over 40 types of glaucoma, their eye pressure is a little too high. Over a period of time, that damages the nerve. What that looks like is that donut hole gets bigger over time. Like someone's eating away at the donut
Oh,
from
it actually
the inside.
gets bigger?
Yeah, the donut hole gets bigger, and you're actually losing the donut material over the nerve material.
Okay.
Well, if you lose that nerve material, there are going to be spots in your vision that you're no longer able to see, which could eventually lead to glaucoma, and that's what's illustrated here. On the left-hand panel, the increase in the eye pressure causes damage to that sensitive nerve. And then what patients actually notice is in their peripheral vision, which is generally where it affects it first, they notice they're not seeing well. But patients don't notice that until it's very late in the disease process because they can still see very well in the center until they notice, hey, I'm kind of bumping into things and things aren't quite as clear. And by that point, it's advanced glaucoma. And none of this damage to that sensitive nerve can be undone. It's what we have, and all we're left with is trying to preserve it as much as we can.
Okay. Now, the natural part of aging, do we lose some of our peripheral vision?
No, you're not supposed to lose some of the peripheral vision. Now, you'll lose a little bit of the nerve, but it should be such a small amount that it's not noticeable.
All right. You mentioned we're not going to go over the 40 kinds of glaucoma. Maybe we'll do an hour show with you sometime. But what are some of the basic differences of the type of glaucoma?
There's two major classes. There's an open angle class and a closed angle class. The most common type is the open angle class, where everything else in the eye looks relatively okay, but there's a disbalance between the amount of fluid your eye is making inside of the eye and how much that fluid is leaving. There's also a rarer type of glaucoma where the drainage system of the eye closes very quickly and the fluid accumulates very quickly and causes damage to the nerve.
Okay, when you talk about, we're going to get into the diagnosis in just a moment, but when you talk about pressure in the eye, one of my thoughts is, well, is this the causes that may cause heart disease and pressure in your arteries and things like that, the usual causes that we all talk about, your diet, maybe you have diabetes, these kinds of things. Does those factors play a role in maybe getting glaucoma?
Some of them do and some of them don't. Actually, there is a type of low blood pressure that can cause a particular type of glaucoma called low tension glaucoma. Now, I'm not saying having high blood pressure is good. I'm just saying there's other types. Some of them cross over and some of them don't. Yeah.
All right. The diagnosis of glaucoma. We've got a couple more photos here and good illustration, a healthy optic nerve and one that has glaucoma. You can really visually see what you were talking about, the widening of that hole, that donut hole.
It's just like someone's eating away the donut from the inside. That donut hole gets bigger, and we don't want it to get bigger. We want to keep a nice, healthy nerve. Now, it's normal for everyone to have a little bit of a donut hole. You're supposed to have that. That's normal anatomy. We just don't like it when it gets bigger.
Okay. So over here, this is the instrument that you use to be able to really see?
Yeah, that blue light that you're seeing is one part of our eye exam. That's the one that checks the eye pressure. But in order to get a complete exam for glaucoma, there's other sections in the eyes that we look at to make sure we have all of our problems addressed. Again, there's over 40 types of glaucoma. We want to make sure we exclude the more exotic types before we think it's just the regular open angle types. For instance, An infection in the eye can cause glaucoma. Inflammation in the eye can cause glaucoma. Cancers can cause glaucoma. We want to make sure it's none of those before we get into understanding what we need to do, because the most important thing the patient wants to be concerned about is, so what are we going to do in terms of our treatment?
Right. And here is another way to diagnose it. What's on the side here? This is basically what you're seeing on your display, right?
That is. Okay. And one of the things I really love about my field is we have a lot of new technology and gadgets. What we have here on the left side is called an OCT, or an optical coherence tonometer. What that actually does, it measures the thickness of the optic nerve of that donut that we're talking about, and compares it to other people the same age, and also lets me compare from one visit to the other. On the right-hand side is what people are more familiar with. That's the visual field machine. That's the one that measures your peripheral vision. It's a lot like playing a video game. You see a bunch of bright lights and you click when you see them.
Okay. Now let's move on to treatments, and I assume a lot of it depends on how advanced it is, right?
It is, and the way I think about treating patients is each one of them is a unique puzzle we have to put together.
Okay.
Because everyone is presenting at a different type or different time in their disease process, and we need to figure out how much damage do we have, and more importantly, how quickly is this progressing? For someone who's older and the disease is progressing slower, we have a tendency to be more conservative with our treatment.
Okay.
If someone is younger and it's more aggressive, we need to be more aggressive with our treatment.
Okay.
And these are the general three ways of us treating people with glaucoma. You have various amount of eye drops on the left-hand side. There's also a few different types of laser procedures we can do, and then there's bigger glaucoma surgeries we can do later on. And this is sort of the spectrum of going from more conservative to more aggressive, less risk going to more risk. And we always like to be on the more conservative side of things if we can.
Okay. Is it reversible, or is it just treatable to maintain it?
It's not reversible. We can try to control it, but it's not reversible. But the farther you get along in the disease process, the less time we have to get it under control. The good part about it is this. We talked about not wanting to lose a lot of that donut material. You can actually lose up to 50% of it before the patient even notices anything.
Wow.
Yeah, so if we can catch it early and get it taken care of, we never have to resort to doing the much larger procedures later on. Again, the importance of getting a routine eye exam.
Yeah, exactly. How often? Once a year?
Once a year should do it. And it's not just for glaucoma. On a routine eye exam, you're going to be able to pick up other diseases in the eyes, or sometimes diseases in the body you didn't know you have. You can pick up high blood pressure, diabetes, or some other autoimmune diseases can be picked up that way.
Yeah, I've heard of that. High blood pressure sometimes can be picked up with an eye exam quicker than other methods. So something that we often think of is that as we age, when it comes to different types of diagnosis or different types of checkups, so to speak, we usually increase those. But when it comes to an eye exam, as you have pointed out, you could start the stages of glaucoma at age 20.
Believe it or not, glaucoma starts as early as babies being born.
Wow.
All the way through that entire life.
So is it hereditary or just something?
Yeah, it's over 40 types. So some of them are hereditary. Like most common risk factor is a sibling with glaucoma. But there's other things you can get, like an infection or cancer in the eye that's not really hereditary either. That's why it depends.
Okay, so get your eyes examined once a year at least. Great to have you on here today. It's always good to see you.
Thank you so much. And if I could just relay one message.
Please do.
Next Tuesday, we're giving a free community seminar talk at our office. And I'm actually leading it. I'm going to have an hour-long discussion about it, glaucoma. Whether it's one of our patients or just any patient in the community, feel free to reach out to us. You're more than welcome to come in.
Okay, this is at your main center. That's right over here.
That's correct. Yeah, just go ahead and they can call our office and we can give them that information. Everyone in the community is welcome to come.
Okay. Great. Thank you very much.
My pleasure.
It's
Thanks.
great to see you, as always.
Thank you, guys.
And we'll be right back.